Hello everybody, welcome to my channel. Introduce myself. My name is Kadek Gusros Nabitra Putra. Now I want to giving you some explain about coronavirus. Okay, let's begin. Severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2, better known as the coronavirus, is the new type of coronavirus that is transmitted to humans. This virus can affect anyone, both infants, children, adults, the elderly, pregnant women, and nursing mothers. This virus infection is called COVID-19 and was first discovered in the city of Wuhan, China, at the end of December 2019. This virus spread quickly and has spread to other regions and in China and to several countries including Indonesia. Okay, everybody, next we start to the main materials. Is beginning from symptoms of coronavirus. Coronavirus infection or COVID-19 can cause sufferers to experience flu symptoms such as fever, runny nose, choke, sore throat, and headache, or symptoms of severe respiratory infections such as high fever, choke with phlegm, and even bleeding, shortness of breath, and chest pain. However, in general, there are three general symptoms that can indicate someone is infected with the coronavirus. Namely, is the number 1, fever or body temperature above 38 degrees Celsius, choke, shortness of breath, and 2, according to research, symptoms of COVID-19 appear within 2 days or 2 weeks after exposure to the coronavirus. Okay, next material. Cause of coronavirus. Coronavirus infection or COVID-19 is caused by coronavirus, which is a group of virus that infect the respiratory system. In most cases, coronavirus only cause mild to moderate respiratory infections such as flu. However, this virus can also cause severe respiratory infections such as pneumonia, middle as respiratory syndrome or MERS, and severe acute respiratory syndrome or SARS. It is suspected that the coronavirus was initially transmitted from animals to humans. However, it was later discovered that the coronavirus was also transmitted from human to human. A person can get COVID-19 through a variety of ways, namely, inadvertently inhaling saliva specialist from sneezing or choking. COVID-19 sufferers holding mouth or nose without washing hands first after touching objects and that are exposed to saliva splash. COVID-19 sufferers contact with COVID-19 sufferers such as touching or shaking hands. Coronavirus can infect anyone, but the effect will be more dangerous or even fatal if it occurs in elderly people, pregnant women, people who are sick, or people whose immune system are weak. Next, coronavirus diagnosis. To determine whether the patient is infected with the coronavirus, the doctor will ask about the symptoms experienced by the patient. The doctor will also ask if the patient is traveling or living in an area that has a case of coronavirus infection before symptoms appear. To confirm the diagnosis of COVID-19, the doctor will carry out the following follow-up examinations: blood sample test, throat swab to examine sputum samples or PCR test, chest X-ray to detect infiltrates of fluid in the next main material. Okay, coronavirus treatment. Coronavirus infection or COVID-19 cannot be treated, but there are some steps to doctors take to reduce symptoms and prevent the spread of the virus, namely, refer COVID-19 sufferers to undergo treatment and quarantine in a designated hospital. provide a fever and pain reliever that is safe and appropriate to the patient's condition. Ensure COVID-19 suffers to perform independent isolation and adequate rest. Ensure COVID-19 suffers to drink plenty of water to maintain levels of water, body fluids. Okay, next to the last main material to explain today. Coronavirus prevention. Until now, there is no vaccine to prevent coronavirus infection or COVID-19. Therefore, the best prevention method is to avoid the factor that can cause you to be infected with this virus, namely avoid traveling to public places that are crowded with visitors or social distancing, use a mask when doing activities in public places or crowds routinely, wash your hands with water and soap or hand sanitizer that contain at least 60% alcohol after doing activities outside the home or in public places. Improve endurance with a healthy lifestyle. Do not touch the eyes, mouth, and nose before washing hands. Avoid contact with animals, especially wild animals. In case of contact with animals, wash hands afterwards. Cook the meat until completely cooked before consumption. Cover mouth and nose with tissue when choking or sneezing, then throw the tissue in the trash. Avoid being close to people who are sick with fever, choking, or colds. Keep clean the objects that are often touched and environment cleanliness. For people suspected of being affected by COVID-19 or included in the ODP or monitor person category, there are steps that can be taken so that the coronavirus is not transmitted to others. Namely, do not leave the house, expect to get treatment. Check with your doctor only if you are experiencing symptoms of respiratory distress accompanied with fever or meet PDP criteria or patient under surveillance. Try to stay apart from others for a while. If it is not possible, use a bedroom and bathroom that is different from what others use. Forbid and prevent others from visiting or your until you completely healed. As much as possible, do not have meetings with people who are sick. Avoid sharing as eating, drinking, utensils, toiletries, and bedding with other people. Wear masks, gloves in public places or with other people. Use tissue is cover mouth and nose when choking or sneezing. Then immediately throw tissue into place rubbish. Okay guys, that's all about my presentation about coronavirus or COVID-19. Okay, thank you for watching and don't forget to like, subscribe and share this video for to other people to get important information. Okay, thank you, goodbye.